Hey everyone, it's Dr. Rick, and this is an answer for Alvin, one of my subscribers on YouTube, who had asked me about if there's a specific diet that would help him gain 9 pounds of lean body mass or muscle. This might be easy, especially those of you who have gone through different diets, to figure out what would serve you most, but Alvin is an 80-year-old, 5'5", 120-pound male. He did not comment on how much he exercised or if he kept busy during the day, but I'll try to answer this in general terms and show you data that might inspire you to move forward. Like Alvin, we're all worried about maintaining longevity and perhaps compressing morbidity. Longevity is when you live to a long, ripe age, say 100, that'd be great. But your average 100-year-old that is gorked out in a nursing home isn't kind of cool to continue existing. So we have to be productive, we have to be independent, and I think we have to decrease the amount of medical diseases that we carry. And that would be the compression of morbidity. My friend Andy Weil has always taught me that if you wanted to live a good life, try to live that type of life where you essentially go on existing, having a rewarding lifestyle, and then you suddenly get sick and then you die, but at a later age. So essentially there's no suffering. This really sounds like a morbid subject, but it's important to understand that a lot of Americans are living an unhealthy life. And with the advent of what medicine can offer as far as pills, emergency room visits, surgical procedures, those folks with the unhealthy life that are on the verge of going downhill can be brought back. And not necessarily with life-saving maneuvers, just with medicines, another medicine, surgery, instead of going downhill and ending up in the morgue. I know what you're saying, just refuse everything and die fast, but it doesn't work that way. Because a lot of the diseases that we have are multiplied, meaning that you have diabetes, you have high blood pressure, you have high cholesterol, you have a little bit of dementia, you have arthritis. Now, it's not as easy as just saying, I'm going to stop all my medicines, refuse all surgical procedures, and I'll die fast. It's not that easy. We're in an age where people have not just one medical disease, they have several medical diseases. So instead of just having your gas tank full of disease, like cancer, you'll have your gas tank full of a little bit of diabetes, a little bit of high blood pressure, a little bit of cholesterol, a little bit of dementia, a little bit of arthritis, a little bit of irritable bowel syndrome. All those things together make it so that you suffer just like the person with one massive disease. But when you have several different tiny diseases, as one of those diseases starts to go offline, you start to get symptoms and you start to go downhill. But eventually, because of your suffering, you will listen to your doctor, immediate care center, emergency room, or specialist, and you'll take that little pill to take care of that medical problem. And then another medical problem will go downhill, and you'll listen to your doctor because of the suffering, because of pain, you'll take another pill. So you'll have all these rescues that take care of these multiple problems, so you never really die of one disease. You just carry the disease on because, unfortunately, medicines take care of most effects, but they don't take care of the cause. And that's why I wanted to discuss today is if you're going to worry about cause, then you go to the most important root cause of everything disease-wise. That would be not enough exercise or activity, not eating to support muscle and activity and cardio and proper thinking, having poor sleep, and just being angry. All those things are important as far as a healthy lifestyle to maintain so that you will get to that designation of centenarian. So for Alvin, I don't know your whole history, but I do appreciate you being one of my oldest subscribers. I'll give you my 2 cents as far as a healthy lifestyle to apply at either 40, 60, or 100. In Alvin's case, you certainly are looking at the lowest hanging fruit, which would be muscle mass. It's easy to measure that. But in a way, it's not the lowest hanging fruit. It's probably the highest hanging fruit because muscle mass, when you're older, is very difficult to develop. Again, if you practice a healthy lifestyle, it should theoretically develop. Maybe at the same time, your strength will develop. Now, this will take time, and time requires patience. So if you have anxiety, this isn't going to work for you. So get that thing taken care of first. If you have an injury, get that looked at by a physical therapist. If you have a sleep disorder, please ask your primary care doctor to help you with that, reverse the disease. And if you have any other medical problems, try to get them under control. That will put you into the direction of being a blue zoner. Check out Daniel Buettner's book, The Blue Zones, which shows pictures of centenarians being active. I still remember one of those pictures in black and white, I think it was from Sardinia, of a centenarian, that's a 100-year-old man, putting a fence post in around his property. If that's not an explanation for independence, I don't know what is. So it's no secret, if you live a healthy life, if you sleep deep, go to sleep early, wake up early, and you practice loving kindness, the likelihood is that you'll have less disease and you'll live a long life. So the naysayers will say it's all just random. No matter if you lead a healthy life, if you eat like a vegetarian, exercise like a marathoner, and go to sleep early, the chances are still there that you, even though you've invested, will die like anybody else and still have the bad outcome. Possibly. But I use data, and data gives us hope in trying to construct the optimal diet, exercise, lifestyle, practice so that you will have less suffering. The first study is by Wang. It talks about skeletal muscle mass as being a predictor for longevity. This was a pretty good prospective study. In particular, I like the way they talked about trying to measure body mass index, but not using height. Usually to measure body mass index, you need weight and height, and then you put it into a formula that you'll find on the CDC or other websites. But as you get older, the possibility of compression fractures, meaning the backbones shrink a bit or they get fractured, and you losing height from that gives you a false number. So what they did in the study with Wang for measurements is they took body weight, but instead of using height to figure out BMI, they used arm length. And the arm length that they measured was from the tip of the fingers to the mid-sternum. They put that into a formula and spit out something that was closer to BMI measurements as is now. The bottom line with Wang's study in the discussion portion showed that if you have less muscle mass, as you get into your 70s, 80s, 90s, and 100s, the likelihood is that with less muscle mass, you'll have more mortality, more diseases. And like anybody that's lived till that age, if you have the expression of disease, whether it's an infection or high blood pressure, your immune system and recovery or resilience will be lower. I think this is one of the secrets why older folks are usually very ritualistic. They'll wake up at a certain time, they'll go to sleep at a certain time, they'll eat the same old food, and they'll exercise within that 1 hour window every single day with their friends at the gym. Because if their formula and recipe for daily living goes off the reservation, the likelihood is that they might express a disease manifestation. As a personal reference for 59 to age 60, I will tell you that my tolerance for delayed onset muscle soreness is much less now than it was in my 30s. When I get sore, I really get sore. However, I turn it around quickly still. I dread the day when metabolism and age will catch up with me, and for doing a bad leg day, I'll suffer for 2 weeks. But I have confidence that depending on how I respond as I go through the next couple of decades, that I'll be able to change or manifest my exercise routine or my lifestyle a little bit differently. That's why we need coaches and doctors to refrain from putting you into a cookie cutter and saying everybody should be a vegan, everybody should do cardiovascular fitness. 90 minutes of strenuous exercise per week in integrative medicine is designing a personal program for my patients to, number one, get out of the disease process that they're suffering from, and then to hold steady, and then finally to move forward and beat the next couple of diseases that start to express themselves. But the current paradigm of what preventive medicine is going to your doctor's office once a year, getting a limited supply of cursory blood tests, and being told that you should lose weight, exercise, and sleep deeper. And then you don't see your doctor for another year unless you get sick. For templating a geriatric program of exercise and lifestyle, it's also important to consider gait and speed. Gait is how long your strides are when you take a step. Speed is how fast you cruise, walk, or run when you're on the move. My mother-in-law used to run Phil Am. That was a Filipino grocery store in Orlando. And when she was working, she would be all over the place like a ping pong ball, taking care of business, taking care of other customers, stocking food, cooking up the meals to put on display. She also lived till she was 80 plus. And I could never keep up with her. I'd like to think that my mother-in-law lived a good life, and we provided for her shelter and love and comfort in her final years. But again, the objective is to figure out what kind of parameters we use to guide people into healthy lifestyle, and one of them would be walking and speed. This study by Alvaro Cruz provided a pretty decent measurement of jump height. So by default, jump height will be dependent on several factors. One would be how strong you are. 2 would be your balance. 3 would be your body mass. Because if you're heavy or you're a BMI of 30, the likelihood of you having a high jump height is low because that's a lot of weight to move. But again, just to design exercises or a point of focus for my older patients trying to figure out an exercise routine, I would look at explosive tendencies in the legs to get to higher heights. And I know some of you will be worried because you probably have osteopenia or osteoporosis. And if you fall, twist an ankle, or if you're really severe, if you just jump a little bit higher than normal, you'll break a hip. I will not deny that there is a possibility of that. But the treatment of choice is either going to be taking a medicine to beat osteoporosis, or working on your jump height. Now, you don't have to be a springboard and jump up 5 feet. You just have to jump up a little bit as far as your exercise. You can even jump rope, and I have a video on how to jump rope and variations to it, which is really fun. If you're really severe osteoporosis or osteopenia, you might want to work on a vibration plate first. The data showed that vibration plate use 15 minutes at a cycle per second of about 50 to 60, usually in 2 years' time, would reverse the osteoporosis. And I gotta tell you, this business about Medicare only covering DEXA scans every 2 years is ridiculous. I mean, how, as a coach, am I supposed to be able to manipulate my patient's exercise routine and nutrition based on a test that's done every 2 years? What I do with my patients, in addition to that every 2-year DEXA scan, is every 6 months I'll get a blood test and a urine test, and sometimes a blood PTH or calcium level, to determine if you're breaking down more bone in an unhealthy way. If we find the exercise that you like and nutrition that you'll stick with, and we document with blood testing and urine testing every 6 months or so that you're producing less metabolites of bone breakdown, then we win. That's probably going to be your groove that you stick with. But it's easier to fine-tune every 4 to 6 months with adjustments than waiting every 2 years and finally saying, okay, you have osteoporosis now, it's not changing, it's getting worse, and we can't adjust anything any further, so just sit on your couch, watch Netflix, eat crappy food, and take the medicines for osteoporosis. Oh, by the way, they cause reflux, and you'll never be able to have your jaw worked on because it'll be so fragile that the dentist will put their drills right through that porous bone. Yes, that's a side effect of osteoporosis medicines. The final study that I'll reference for Alvin would be muscle mass or muscle strength. Muscle strength can be an arbitrary measurement, but the specifics in this study measured grip strength. Rantanen used grip strength across the board with 70, 80, 90, and 100-year-olds to determine 2 measurements: grip strength and long-lived mothers. If you possessed higher grip strength than the average in your age group, the likelihood is you would go on to survive other diseases and live a healthy life. In addition, those patients who had moms that lived also into their 80s, 90s, and 100s, it was found to be a predictor of longevity as well. So in a sense, that would be genetics based on mom's history, in addition to acquired strength, all over, but specifically grip strength. So Alvin, all these things tell you that it's important to have some form of muscle development, muscle strength, and continue with that kind of exercise or lifestyle all throughout your life, even into retirement. In fact, I challenge my patients that are hitting retirement and say exercise, but also because the protein signal is lower. I have an old video I did on protein signaling and muscle degradation, and it's important as you get older and there's less hormone, unless you're taking testosterone, as written by me, the likelihood is that your protein signaling will not preserve muscle. So if you do a high-carb, low-protein diet, the likelihood is you're going to burn glucose for energy and muscle for energy by mistake. On the contrary, if you have a low-carbohydrate, high-protein diet, the theory is that between those exercise days, when you have high-protein signaling to muscle, you will have less muscle breakdown. Check out the videos I did before, but if you wanted the easy formula, 1 gram per pound of lean body mass would be a decent amount of protein per day. And that's going to be hard to get that much protein in. Antonio Reyes, one of the exercise physiologists out of the Florida universities, has proven that even if you crank up your protein to high level per day, the likelihood of having problems with your liver or kidney are low. It's always going to be difficult to manifest. It's trying to squeeze in that much protein into the day. The problem with trying to meet the demands of that much protein in a 24-hour cycle, you'd have to fit in more meals per day. And for older patients, the appetite is already compromised, so it's hard to get more food in. So that's why I like protein supplements or protein powders. Again, check out my videos down below, and do give a thumbs up in case this video helps you, or share it with other people that you think are on the fence about trying to define themselves with a new exercise routine, or at least find a lifestyle change that's healthy for them. In the advent of the internet and all the information, you will get very frustrated and really poor because of all the things you go through to try to find longevity. This should be something that your doctor should help you with. But the problem I find is that most of my colleagues don't have enough time to teach or tutor. And that's why you have to be an advocate for yourself. But do read, but not too much, somewhere in the middle where it gives you enough empowerment to find a new routine that you might be able to deploy or experiment with. And if it serves you properly with no blowback or collateral damage, put that in your toolbox and search for the next change that might fit your paradigm. Thanks for watching up until this point in time. Alvin, great question. I am very honored that you're watching my videos. Now that we're maskless in the state of Illinois, there's a lot of great things to look forward to for summer. Take advantage, get outside, try to exercise, and I'll see you at the next video.